The DO company showed us that what's going on at the implant dentistry, so that after 10 years, the digitalization is a key word to improving the implant dentistry now. The DO company had the proof. So is that correct or incorrect? Mm-hmm. So because they have many research, so DO Navi is very stable to place the implants.
Oh, very fantastic and very exciting symposium. I like this family in family style. I like it.
Okay.
Yeah.
So your event is more like family gathering.
Yeah, for family gathering all over the world.
Thank you. So
I already used the UF implant 2 years ago, and now I use a 3-1 system. Yeah, I believe this system is quite effective, clinically useful, very useful. I don't use another intraoral scanner, only Turios.
Okay.
But Turios is very useful and very like 患者のためにってなんて言えばいいですか?
For the patient.
For the patient, yeah.
So now I'm studying about sinus lift in my university. So I want to use the DIO implant because thread and surface it's really nice, and I think the more quick than other company to get primers to get also integration.
Okay.
It was an absolutely excellent event that brought together professionals from worldwide and that made possible sharing experience, vision of different approaches of different professionals in some very important and crucial aspects of implantology and dentistry in general today. What I personally appreciated most was the fact that this symposium was not a commercial event, was mainly, or for better to say, totally an educational event. Through this event, DO transmitted new knowledges, revised protocols, guidelines, and also experience of very professional and excellent speakers. So I feel absolutely delighted and honored to be part of this symposium and to be also the MC of the event.
First of all, fun. You know, whenever there's a conference in Vegas, it's fun. So I think everybody had a good fun. But as you can see, there was a lot of top speakers here. In my lecture, I focused on aesthetics and how the dentist can really receive a predictable long-term result. So I had a lot of fun, presenting our research from which we have developed over the last 20 years. I showed some videos, how the steps are, and I hope really that the participants of the conference are going to be able to improve their results in their patients.
For you?
Yeah, so a paradigm shift for me is probably something where you can see that the steps or the treatments and diagnostics we're using are really improving our results. They could be less invasive, could be better information, and you can see, of course, that the paradigm shift mainly is today in digital. So there's a lot of more focus on digital planning, guided surgery, planning and CAD/CAM fabrication of abutments, digital impression taking. So a lot of these things, of course, were discussed here at the conference, and I really think that that's a paradigm shift.
Well, I think the dental implant industry has been undergoing a paradigm shift for quite a long time. But it's only recently that technology is trying to catch up in terms of what we can do, both from a diagnosis, a treatment planning, the type of design of the implants, the abutments, three-dimensional imaging, and now CAD/CAM technology. So to me, the paradigm shift is moving from an analog world into a digital world. And this is something that I've tried to pioneer for almost 30 years now, and it's wonderful to see it all happening. Well, I think DO is already making the move by investing in new equipment, in new software, in CAD/CAM, and in training their people to be able to utilize the software to create CAD/CAM abutments, to create frameworks, and also to be able to assist the clinicians with guided surgery. But even in the area of the implant design, the abutment to implant connection, all of those components and all of those pieces have to fit correctly to enable our clinicians to provide the best care for their patients.
It's very impressive, and especially Mandalay Bay is an amazing hotel. And you have a very good show. You have what, more than, I think, 300-400 people showing up. Yeah. So it's considered to be a very successful meeting. And furthermore, I think what impressed me is you have some really famous international speakers like Dr. Tarnow, Dr. Yamasaki, Dr. Jovanovic. So it's not easy to get all those famous speakers. So I think it's a very success. Because before, one of my complaints to your reps is, the smallest implant before is, I think, 3.8, right? Yeah. And then that is sometimes too big for lateral incisors or mandibular incisors. Now with the newer system, yes, I think it will be much more complete now.
We have now 3.0 and 3.6.
That's right, that's right. Yeah. And that will be very helpful.
You may try.
Absolutely, I sure will. Just make sure the rep sends some to me.
Sure,
I will use it.
Okay.
Well, the thing I think now more so than ever, the interesting thing is, I think the general public, the patient population, they're looking for, like natural aesthetics, like just almost like really natural. And also they want things to be a little bit faster, like, we'll be tendency of doing more like immediate situation, immediate function situations. Mm-hmm. And moreover, patients are looking for doctors that want, to have a higher technology, okay, more like guided surgeries, okay, more predictable. So I think that is the shift, more computer-generated technology, computer-generated prosthetics and surgical things. And I can see your company are pretty much on top of that. So I think you folks are going through that shift along with the world, so that is good.
I think that they're working hard to be the best that they can be, and it shows. And I think that's the fact that they keep changing to become better. For example, the new implant with the new surface textures, the hybrid concept, I think is always very, very valuable. I think having a moderately rough surface at the top is safe, yet it can still integrate. And having a more aggressive rough surface in the middle and the bottom, I think is great, because then the bone can integrate better. But at least it's not a periodontal problem, because the top part is less roughness than the middle and the bottom part, apical part. And I think that concept is an extremely important one that more companies should be looking at. Some companies have done that in the past, and I'm so glad to see that you're doing that again. Sure. Well, I think it's going to get faster. I think the idea of not just a single tooth or a small bridge, but also the whole arch will be able to be designed digitally now with greater accuracy. I think when you go around the turn of an arch, the accuracy is not perfect yet. So I think that's going to change. I think it'll get better and better as the technology gets better. And I think that it will be used more and more, and eventually schools will not even teach impressioning the way we do it today, especially for implants. The nice part about implants is you're not worried about blood, different than a tooth, impressioning of a tooth. If you prepared a tooth for a crown, you have blood sometimes in the way, and you can't get a good accurate impression of the margin, a digitized impression of the margin, because of the bleeding. So you got to pack cord and everything. Yeah. The beautiful part about a scan body is that it just attaches into a fixed place, and it sticks up away, and it doesn't matter. It doesn't matter if you have a little bit of bleeding. It's not critical compared to a preparation of a natural tooth. Well, I think what I expect is for them to keep growing. They're obviously looking at every way they can to use the latest technology,
And I think I applaud them for that. And I think that that's what we're going to see. The companies that do what they're doing will be the ones that grow and be the ones that people will go to in the future for their digital needs as well as their implant needs. So right now you have a good implant, but you're also now developing the prosthetic side and make it easy for the patient and easier for the doctor. So I congratulate you for that.
Thank you so much.
You're welcome.
Okay. Thank you for the interview.
Thank you.
Yes, this is my fourth symposium. I attended the first one ever DO put together in 2008 in Busan. And I still remember there were around 50 doctors in the audience. And I lectured after that in 2012 in Busan, again 2013 in Beijing, and now in Las Vegas. And every year I can see the growth and the improvements, always better and better, more participants and more speakers, and so there is a big improvement over the years, and very happy for the success, and grateful for the invitation and the opportunity to be able to speak at the DO Symposium. I think the growth of the company, the line of products that been introduced in the last 3-4 years, it's very fast, very vibrant, definitely company. So last year was the release of the UF implant system, which was a good size improvement over the SM line of products, and then we had the scan body for the UF, the simplicity, and again the of the whole of the system in general over the SM line, and now the introduction of the guided system. That's definitely a good size step over the what was available from DO. So I think the growth rate in product and in size is definitely very good, very healthy, and I expect very good success, and having I expect to see DO getting a bigger and bigger share of the marketplace for among oral implantologists, because the quality of the products and the direction of the company toward digital dentistry.